Hello, everyone. Welcome to Arthritis Fact Checked on Instagram Live. So lovely to have you all with us this a bit grey Friday afternoon where I am. I hope it's a bit nicer where you are. But I'm Mark Williams. I'm the Services Manager for Arthritis Action. And I'm joined today by Dr. Wendy Horgan, who's a consultant rheumatologist and also medical advisor for the charity. Hello, Wendy.
Hi. I'm very excited. Bit nervous, but excited to be doing this live.
Oh, it's good. It's going to be all good. We'll have a good time. So let's explain what we're going to be doing today. So, I mean, the internet is a wonderful thing. I'll try not to make this too rambling, but it's a wonderful thing. You know, the world of information at your fingertips, which can be brilliant if you're looking for, information or tips or tricks, whatever, for you managing your arthritis. But at the same time, there is a lot of nonsense on the internet and a lot of, shall we say, misinformation and a few odd things on there. But sometimes it's hard to tell what's true and what's not, and even where the grey area kind of lies. So I thought it'd be fun today, Wendy. I've trawled the internet for loads of stuff about arthritis, and I'm basically going to throw it all at you, and then you can fact check it and tell us what's true, what's not. And
Excellent. Hope it'll be
cool. And also, for those of you who are watching it today, if you want to throw a question in there, please use the question function at the bottom. Do keep them short and concise, though, because it only comes up in tiny lettering at the bottom. So, forgive my eyes. I've got my glasses on, but, I'll do my best still. But let's get started, shall we? We'll go for something nice and easy. I've got a few easy openers just to ease us in.
Okie doke. Go for it.
Start with, is there a cure for arthritis?
Sadly, no, but lots you can do to help yourself. So go to our website for more information.
Absolutely. That's www.arthritisaction.org.uk as well. You can find the link in our bio as well. And okay, next question then. Is exercise bad for arthritis?
Definitely not. The more exercise you do, the better you're going to be, even if your joints are inflamed. So exercise is good on all sorts of levels, helps pain, reduces inflammation, loses weight. So no reason not to be exercising.
Excellent. That's good to know. Good to know. Right, now we've got some sensible ones out of the way. Let's start getting a bit sillier. So, can drinking while standing cause arthritis or joint damage?
I love this story. The's a theory that if you're standing up and you drink water, it goes all the way through you and directly from your mouth to your kidneys and can damage your joints. Clearly, that's nonsense. That's written by someone who knows nothing about anatomy. We've got all sorts of valves along the way to hold the water in, so definitely not. No.
I was wondering if people just think that your body starts filling up from the feet up or something like that. I'm not quite sure what they think.
Well, I've got hollow legs, so that's what everyone watches me eat. Anyway.
Yeah, cool. Good. So, yeah, that's a no then. A hard no for that one. Yeah. Okay, so let's do a little true or false round now. So I've got just a few little things where you can tell us whether these are true or false, or maybe even somewhere in between. I don't know. So, first one, true or false? The weather can make your arthritis worse.
True. It can not make the arthritis worse, but it can certainly make it hurt more. So I've had shoulder surgery, and I know when it's going to rain. So my shoulder will tell me when it's going to rain. And there've been a really nifty study done a few years ago showing that changes in weather pressure can make certain people sensitive in their joints. So definitely some truth in that. Yeah.
Excellent. So, true or false then? The side effects from taking arthritis medication are worse than the arthritis itself.
Good question. Now, it kind of depends on where you are on the scale of arthritis there. So if you have bad arthritis, then generally the medicines will make you feel better. But if you have not so much arthritis, sometimes taking the medicines can be worse than not taking the medicines. So it all depends. And for some people, side effects are intolerable. So for me, I wouldn't be able to tolerate heartburn. Other people wouldn't like hair loss and things like that. So sometimes, yeah, definitely.
Okay. So next one, true or false? If you have arthritis, you can't have children.
False. Definitely. Not a reliable form of contraception.
I've not even thought of it that way. Okay. Right, so this is one for my mum, actually, because this drives her absolutely insane. True or false? Cracking your knuckles can cause osteoarthritis.
False, definitely. But extremely annoying. There was this really cool experiment that this guy did, who's a doctor in California. His name was Donald Unger, and he cracked the knuckles of his left hand at least twice a day for 60 years and left his other hand alone. And after 60 years of doing this, they were exactly the same. So it doesn't cause arthritis, but it should be stopped.
Yeah.
Illegal.
I'm still doing it. I'm still going to keep doing it. So sorry, Mum, that one's not going away. Speaking of parenting then, so true or false, if your parent has arthritis, you'll get it too.
No, that's also not true. It can run in families for sure. Certain types of arthritis can run in families. So if one of your parents had very, very knobbly knuckles because of osteoarthritis, you may well develop similar hands. Rheumatoid arthritis can also run in families, but it's not a direct line. It can often skip a generation or not happen at all. So no need to feel guilty about your children if you have it.
Okay, good. Oh, we just had a question come in actually. So before I go to my next round, let's do this one.
Yeah.
So does hormone replacement therapy alleviate arthritis?
What does it?
Osteo. Does HRT alleviate OA?
It doesn't make it go away, but it absolutely 100% can help with the pain. Often menopause is a time when women start to develop osteoarthritis and get pain in their hands and pain in their neck in particular. And replacing the estrogen in particular can really help a lot with that morning stiffness and pain, and sleep as well, which of course is vital for pain management. So absolutely, yeah, absolutely.
Okay, great. Oh, here's another one actually. Can the shingles vaccine cause a flare-up for arthritis?
Yes, it can. So anything that's challenging your immune system, so for example, a virus or a vaccination or COVID, as lots of people have discovered, can definitely trigger a flare-up of arthritis. It will pass, but it can happen, yeah. Okay,
great. So next one, we're into the food category now. Okay. This is but there's always loads of stuff about food on the internet about food and arthritis. So what are your thoughts on these following foods? Okay. Number 1, tomatoes.
Excellent foods, tomatoes. So lots of people think tomatoes and vegetables and in fruits in the nightshade family should be avoided for arthritis. I don't really know where this has come from, because all of those vegetables are really rich in things called lycopenes in their skin, which are antioxidants. So tomatoes and aubergines in particular are really good for having anti-inflammatory properties, and they contain fiber and all sorts of minerals as well. So no, definitely not. Tomatoes are good in general.
Good. Excellent. What about citric fruits?
Similar, lots of fiber in oranges and vitamin C, of course, which is an antioxidant. So no, also good for arthritis.
Fruit in general, I think, has a really bad rap when it comes to health in general, doesn't it?
It totally does. I mean, too much sugar in any form is not great for anybody, but you're going to have to eat a lot of fruit to go over that limit. Yeah.
I don't think anyone's problem, or maybe some, but not many people's problem in their diet is really just, I can't stop binging like 20 bananas on a Friday night. I think that's the main thing people are doing wrong. So yeah, my next one was going to be sugar. So, you sort of answered that. Do you want to elaborate more on sugar?
Sugar on its own. If you eat a lot of sugar, obviously you will tend to put on weight, and foods rich in sugar like cakes and biscuits and stuff are going to pile on the weight and can be kind of pro-inflammatory. So in general, reducing sugar is good. Also, if you eat a lot of sugar, it's not brilliant for the gut bacteria. So try and reduce sugar, but occasional cake is not going to do you any harm.
Lovely stuff. Okay. What about dairy products?
Similarly, I mean, there's lots of good things in dairy, like masses of calcium and masses of protein in dairy. It's a really good way for lots of people to get their calcium. But some people are a little bit sensitive in their gut to dairy products, in particular milk, not so much cheese and yogurt, but milk. So some people need to steer clear of milk because it can cause diarrhea. But Again, no evidence that that will be a pro-inflammatory or hurt arthritis.
What about things like dairy alternatives? Is there any sort of difference there for that?
No, not really. I mean, obviously some people can't take lactose, so that's fair enough. So you'd need to be drinking oat milk and things like that. No, so those are all fine as far as I know. Please correct me if I'm wrong on that. Or Martin, if you're listening, correct me if I'm wrong. But I think those are all okay as well.
Okay, excellent. So now let's move on to my next round. I am quizzing you. I was about to say, I'm quizzing you. I am. So this is off various articles I've found on the internet from all over the world. Some interesting stuff. So let's see what you think about some of these. Okay. Can you get a diagnosis for psoriatic arthritis via a blood test?
Oh, that's an interesting one. So they're doing a study at this very moment as we speak in Dublin to look at that very thing. At the moment, it's difficult to detect those people that have psoriasis, which is a skin condition, will go on to develop psoriatic arthritis, inflammation in the joint. So at the moment, it's about 1 in 3 people will with psoriasis will develop psoriatic arthritis, and we don't know who those ones will be. So what they're doing in Ireland is that they are checking, I think it's 25,000 people with psoriasis, and they're looking at markers in their blood, and then they're following them to see which ones get arthritis. And they have got some promising results so far. So they're hoping to identify these people early so that they can get on the correct treatment and then prevent joint damage. So it's really, really important stuff. So not at the moment, but it's coming.
Excellent, very cool. So, okay, next one. Do postmenopausal women have a higher chance of developing rheumatoid arthritis?
Yes, definitely. So the prevalence of rheumatoid arthritis goes up with age anyway, and it's more common in women, but it's especially common in women who have an early menopause, in other words, menopause before the age of about 40, 45, 46, 3 times more common in women who have an early menopause. And I think that's interesting because it kind of backs up what we just said now about HRT being in general for joint health, and not just that, inflammation as well, which is interesting. We don't know the full story yet.
Okay, great. Someone mentioned something about this in the chat down below earlier, so sorry, I didn't ignore you. I just knew we were coming to this one. But can vitamin D help prevent fractures or falls in older adults?
Okay, so many people in this country are vitamin D deficient because we don't go out and we cover ourselves up with sunblock, which is obviously what we need to do. So many people are low or deficient in vitamin D. So lots of us need to be taking a little bit of extra vitamin D. But the story about vitamin D and falls and fractures has been a bit controversial. So at the moment, the guidance is if you're a healthy older adult, then vitamin D is not going to make any difference to the likelihood that you will fall or fracture. However, if you are more frail or you've got some risks or you're vitamin D deficient, living in a nursing home, then vitamin D is really, really important for fracture reduction and falls prevention, as is exercise. That's one of the most important things you can do to stop falls.
Absolutely.
Yeah.
Okay, so are people with rheumatoid arthritis at higher risk from COVID-19 issues?
Yes, they are. Not only are they at higher risk of contracting COVID, they are at higher risk of more serious COVID and going into ITU and of death. So if you look at all the worldwide statistics on COVID death, it's around 1% of the whole population, but 9% of people with rheumatoid arthritis have died of when they've contracted COVID, which is obviously much higher. But interesting, they think that the people that have died of COVID are much more likely to be taking high doses of steroids with more than 20 milligrams a day, which is a lot of steroids, and that's very immunosuppressing. So that could well be the reason for a lot of those mortality numbers. So stay away from too much steroids, I think, is the message there.
Okay, good to know. Good to know. Are people with rheumatoid arthritis more likely to be anemic?
Yes, another good one. So again, several causes of anemia in rheumatoid arthritis. So it's an inflammatory condition that raises inflammatory markers in the blood, and we know that raised inflammation can cause anemia. So that's a low blood count or reduced iron in the blood. So having inflammation is not good for you. The other thing with arthritis, not just rheumatoid arthritis, is it's drugs that you take for arthritis. So, for example, anti-inflammatories often cause anemia because they cause bleeding from the stomach. And a lot of the drugs that we use, for example, methotrexate in inflammatory arthritis, can sometimes reduce the blood count as well. And then many people are deficient in things like vitamin B12 or folate, which can also cause anemia. So lots of reasons for people with arthritis to be anemic.
Wow, quite a complex one, that one there.
Yeah.
Anyway, I see a few more of you, John. Lovely to see you here today. If you do have any questions, feel free to add them into the comments. Yeah, and if keep it nice and short, concise, and we can hopefully answer some of those as well as the ones I've got prepared. So, love to hear from you guys as well. So, again, we're being silly again now. I'll say silly, but this is real stuff that's actually out there. Wendy, what are your thoughts on tiger urine being used to cure arthritis?
I have a glass every morning. It's just an unbelievably bizarre story. So in China, I've gone round to the basins where the tigers do their thing and collected tiger urine. Imagine how disgusting that is. And I've come up with the idea that this might be good for arthritis somehow. So they say what you're supposed to do is mix it with white wine and ginger, rub it on the affected part. That was the first thing. But then they have started selling it to drink as well, which, what can you say? Absolutely no evidence for that, obviously. And I think it could be incredibly insanitary as well. I wouldn't fancy drinking my cat's pee, let alone tiger's pee.
No, it's got to be 10, like 10, 20 times the potency, I imagine.
Quite dangerous to collect as well.
Yeah. Do you reckon Siegfried and Roy had arthritis? Because if this is true, I doubt it. Okay, so hard no for that one. No evidence, right?
Hard no, yeah.
Good. Okay, a bit more sensible now. Is it possible that stimulation of the vagus nerve could cure autoimmune conditions?
This is really, really interesting area. So I'll say what the vagus nerve is first. I think that'd be helpful. So the vagus nerve is a main thing. The brain to just about everything else. It starts at the brain stem, and there are two branches that come down the neck, join up, and then they control all of the internal organs, the digestion and the liver and so forth, and the gut, of course. And scientists accidentally found out about 20 years ago when they were trying to treat brain inflammation in mice that stimulating the vagal nerve reduced inflammation in the body in general. So we know that the vagus is very important for inflammation in general. So it sends messages up and down from the gut to the brain and the higher brain. So what we know for sure is that if you have increased vagal activity, you are more likely to be in an anti-inflammatory state. And there are things called vagal nerve stimulators, which are either implantable devices that can go inside the body, usually in the chest, and they stimulate the vagus nerve, usually in the neck, or external devices that are placed on the neck that can stimulate the vagus nerve. And those are already being used for conditions like epilepsy and depression with some really great benefits. And it's thought that might have an influence in inflammatory arthritis as well. It's all very much in the experimental stages at the moment. So what I think is really interesting is that if you stimulate the vagus nerve, you turn off the inflammatory chemicals in the body, which is really interesting, some of which come from the spleen, for example. What I think is really cool is that you can do your own vagal nerve stimulation maneuvers by things like singing, chanting, meditation, yoga, deep breathing, mindfulness, laughing, splashing water on your face, all of cold water, all of these things can help stimulate the vagus nerve, which is really, really, really interesting. And I think we're going to learn a lot more about this in the future, actually.
That's fascinating.
Yeah, but who knows? Really, really interesting and safe.
Lovely stuff. Oh, that was a surprisingly good one, then.
Yeah, absolutely.
Oh, so the internet does have some good stuff on it. That's nice. Okay, so this one follows on nicely from that. Then, can enhancing the gut microbiome prevent rheumatoid arthritis?
Yes, it does. What we know for sure is that people that have this antibody called the CCP antibody, which is the antibody that goes with rheumatoid arthritis, people that have that antibody, even if they don't have rheumatoid arthritis, have altered bacteria in their gut. And at the moment, they're doing some research in Leeds to see what happens to these people over time, to see if they will, if having altered bacteria will make them go on to develop rheumatoid arthritis. So we know so there's the starting place. We know that people that have rheumatoid arthritis have different bacteria in their gut. To some extent, medications that you take for pain, like anti-inflammatories and stomach protectors, can also affect the gut. So it's not quite clear which one is which at the moment in a bad way. But what we know for sure is that treating the rheumatoid arthritis with drugs like methotrexate can improve the microbiome. So we know that changing the balance of bacteria in the gut can alter inflammation. So this is a really promising area for research.
Great. Oh, it was actually another one which kind of goes a little bit in line with it.
Yeah.
So if you've taken a lot of antibiotics, is it true that you'll have more inflammation and worse pain? So should people with arthritis take more probiotics?
That's an interesting point. I don't think anyone knows the answer to that, but what antibiotics will do is just about kill all the gut bacteria, or kill some good ones as well as the bad ones. So people that take frequent antibiotics will not have healthy gut bacteria for a start. Now, in order to balance that, what you need to do is to work on two things. There are prebiotic things that you can take, and those are sources of bacteria. So things like the yogurts and fermented food, so these contain bacteria. The other thing that you can do which is even better, is to eat foods that are called prebiotic foods. And these are foods that contain a certain kind of fiber called soluble fiber that those gut bacteria absolutely love. So eating loads of these prebiotic foods is the way to go to improve your bowel health in general. And that's things like, if you can tolerate it, oats, things like Jerusalem artichoke, bananas, apples, lots of different foods. And I'm sure there's something in there that most people can tolerate, even if you can't eat things like garlic and onions. There should be something.
Cool. Look, we've got another one in the chat below. So can a TENS machine help?
Help with pain or help with arthritis?
I'm assuming with pain or with arthritis.
Yeah, TENS machine is it's thought to affect the pain nerves, so turn off some of the pain sensitive nerves, and it's a kind of distraction. If you've ever tried TENS, it's sort of it distracts your brain, if you like, from pain. Yeah, so it can be effective for as long as it's attached. Yeah.
I've heard from a lot of people that they find them pretty useful, and they're quite like a cheap and non-invasive way of doing things as well.
Exactly.
Okay, so one you kind of answered already. I'll ask it anyway, just in case anyone's joined a little bit later. But can people with arthritis really predict rain?
Yes, definitely. Because it's thought to be due to a change in air pressure. So some people's joints are very sensitive to that, and it can cause achy joints. Yeah.
There's one because of the barometric pressure of the air. There's an interesting thing that I sort of learned, that a lot of weather apps can measure air pressure as well. So just like you'd look for the forecast, like it'll be sunny at 2 in the afternoon, or it'll rain at 3 or whatever. If you look at the pressure, sometimes some apps actually have the pressure throughout the day. So I know that some people have used it as almost like a weather system for they know their joints are going to be bad if the pressure's really high. So in the afternoon, they'll just look it up. Instead of it going, it's sunny, go, what's the pressure? Because that's the important thing for them. Another useful thing about air pressure. Okay, last one of this round. Is it true that Moderate alcohol consumption can help prevent rheumatoid arthritis.
Aha. This is an interesting one. What would you say the definition of moderate alcohol consumption is?
I think mine and my wife's will be drastically different.
I think most people would say that's kind of, I don't know, 10 to 14 units a week. Well, it's actually, the authors of this paper in Leeds, in the Department of Nutrition, said that moderate alcohol intake was 2 units a week.
Oh, come on now.
Pint of beer, which is associated with a reduced risk of rheumatoid arthritis. So not very much that. I don't know if I call that moderate. But anyway, the bad news on that study is that 7.5 units a week, which is more like what I would call moderate, increased risk. Oh, Mark.
I don't know. I was hoping that the more I had, the safer I would be, was my plan.
What the headline read, wasn't it? But it's not that at all. So I think the guidelines are the same, just everything in moderation. The good news on that study, though, is just 80 grams of extra fruit a day, so that's probably an apple or something like that, will reduce your risk, as will increasing your fibre. So that's interesting too.
So would that mean if you drank cider, you'd be okay?
Well, I don't think that counts as 1.5 a day.
It's have to drink pub logic, I believe, but that's not real logic. Okay, so speaking of causes, well, sort of cures and treatments, actually, this is the final list I have for you, Wendy.
Okay.
I have 13 cures / treatments found from the internet.
Okay.
And I would like to know what your thoughts are on these as a cure or treatment for arthritis.
Okay.
Number 1, borax.
Yes, borax is a cleaning agent, often used with boron, the element. And a little while ago, there was a trend for eating borax, for goodness sake. It's dangerous. Don't do it. Don't do it.
Yeah, that one's mad.
Yeah, it's mad. Yeah.
Right. This one I know is in your wheelhouse. So bee stings.
Bee stings. Oh, cool. Historically, bee stings have been used to relieve the pain of rheumatoid arthritis. And in fact, I knew someone who used to keep some little bees in a tube to take with her wherever she obviously new bees each time. And if her joints were hurting, she'd just stick these bees on her wrist to make them sting her. I don't know what on earth that's about, but I guess the bee sting is so painful that it distracts your brain from the underlying pain. And obviously there's a considerable amount of inflammation that's caused there that takes away your mind from everything else, I believe. I don't think that is good for arthritis, but it's certainly a distraction. Interesting one.
Yeah. We've got one of these in the chat here. Apple cider vinegar.
And no evidence for that. No evidence.
Yeah, thought so. Okay, it's similar to the bees here. Stinging nettles. Yeah,
similar. So if you stick your hand in a pile of stinging nettles, you will get distracted, obviously, by the pain and the itch, but it's not affecting the underlying inflammation.
Okay. What about magnets?
Yeah, nothing on magnets either.
No?
Wasn't there magnets in your shoes and things like that? I think that's gone out of fashion a little bit now, but no evidence for that either.
I think that's possibly why it's gone out of fashion, really.
Yeah. Ditto copper bracelets.
That's my next one, Wendy. That was my next one. No for copper bracelets.
Bracelets.
For fashion only, if you want that.
Yeah.
Okay. Turmeric.
Yeah, that's a good one. So turmeric's active ingredient is curcumin, and curcumin for sure is an anti-inflammatory, but you have to have a huge amount of it for it to have an inflammatory effect. You'd have to have tablespoons of this stuff for it to work. So probably what you're buying in the health food shop is not doing anything. If it works, fantastic. Who cares? But it probably isn't.
Okay, so yeah, the amount you have, because most people have like a turmeric shot or a turmeric latte or something, and that's very tiny amounts, really, isn't it?
Exactly. It's not enough.
Okay, how about glucosamine?
So that's come and gone in fashion. There's no evidence that works for osteoarthritis, but again, if you take it and you feel like you feel better, fine. Work. The placebo effect is very powerful, and go with the flow. It's not going to.
Okay. What about green tea?
Green tea is no evidence that it helps with arthritis, but green tea contains all sorts of antioxidants and so forth, doesn't it? And high levels of caffeine, I discovered the other day. I didn't know that, but yeah, that might be a good thing in general for your health, but no evidence for arthritis.
How about aromatherapy?
Again, no evidence that will help with arthritis, but incredibly relaxing, isn't it? And there are things in aromatherapy oils called terpenes, which give the things like lavender its smell, and those definitely have a pharmacological action that we don't really understand. So we know for sure that lavender is relaxing, and rosemary absolutely can improve your thinking. So it might make you feel better, but it's not going to control inflammation. But go for it.
Okay. Oh, I've had another one in the chat as well. So collagens.
Collagens, no. I mean, when you swallow collagen, your stomach will digest it. So collagen that you swallow isn't going anywhere other than to be digested.
Is there another way to ingest it other than swallowing it?
You can probably inject it, but the collagen that you swallow will be digested by your gut, and it will not be turned into new collagen. So no, they're wasted.
Okay, great. What do we got next? Thunder God vine.
Never heard of that one. That's an interesting.
So yeah, I thought you might not. But this is grown in Southeast China. So it's grown in Southeast China, mostly used for rheumatoid and kidney disorders.
I've not heard of
just a vine, a random vine. Sorry, say that again. You cut out then.
There's a lot of natural plants, aren't there, that have got medicinal effects. So who knows what that's got in it. You know, if you chew willow bark, that will have aspirin-like aspirin in it. So, you know, that's going to help with pain. So who knows? But I don't know what that vine is. So don't necessarily go out and get any.
Okay. Well, willow bark. So willow bark was going to be my next one, actually.
Absolutely. I don't quite know how you do it or how you judge how much to have. But obviously, willow bark is the origin of aspirin, the world's first drug. So, yeah.
Yeah, some pain-killing things, but it's not necessarily an actual treat.
Not going to treat the arthritis, but for sure it will treat the pain. Yeah.
Also,
I call anti-inflammatories.
Something else is out of the chat. How about red fruit? Specifically red fruit.
Well, as we said earlier about tomatoes, red fruit, the substances in red fruit are things like lycopenes and flavonoids, which we know are good for gut health, and we know they're good for brain health as well. So absolutely, go for it. Yeah.
Okay, I've got another food one for you.
Yeah.
Oh, so rose hip has just been thrown into the chat.
Rose hip's an interesting one. Some evidence that rose hip might be anti-inflammatory. So lots of people say their parents used to make them eat rose hip syrup, which is disgusting apparently, and might have an anti-inflammatory effect. Yeah.
Okay. What about just fermented foods?
Yeah, fermented foods are good, as we discussed, because fermented foods will contain bacteria, which are good for your gut health. Again, everything in moderation.
Okay, excellent. And my last one now. What about horse liniment?
Horse liniment. Nice one. Well, I suppose you rub it on rather than eat it. I hope
so.
I mean, what is in horse liniment? I mean, the rubbing on something warming for sure is comforting, isn't it? And sometimes rubbing on something cooling, like we had something about udder mint, didn't we, the other day?
Yeah, we were talking about. Yeah, tell us about that, Wendy.
Which is what farmers used to put on their cows' udders to soothe them. It's a minty thing that contains menthol, so that's a cooling thing. So lots of people have used menthol to rub on joints to cool them down. So again, who knows? Horse liniment, why not? If rubbing it in helps, carry on. Excellent.
Well, good stuff then. So, right, that is all the questions I had for today. So thank you so much, Wendy. That was really, really good. If anyone would like any more information on all the stuff we've talked about, as we said at the beginning, please do visit our website. That's www.arthritisaction.org.uk. Loads of fact sheets, information, articles, videos. And we've also got some podcasts and webinars on there, some of which are very... There's one that we did together, actually, Wendy, about unusual treatments for arthritis, which would be a good companion.
Well, didn't we, Rich? A good one.
Yeah, so there are lots of useful ones. Yeah, loads of good stuff to have a look at. And yeah, I hope you've really enjoyed this today. I've had fun. Hope you have, Andy.
I have. It's been good. Yeah.
Excellent. Thank you so much, everyone, for joining us. I really appreciate it. So we'll leave you to it. I hope you have a wonderful rest of your Friday, Wendy, and everyone else.
Thank you, Mark.
Thank you. See you later, everybody. Bye-bye.